Hi, my name is Lee Keddy, CEO of CompuMed, and today we're going to talk about how consistent, accurate interpretations that the transplant teams can verify promotes trust and can improve transplant rates. Here's a donor funnel chart. We're going to talk mainly about step 6 to 7, which is the handoff between the OPO and the transplant center. Now, the truth of the quality of the organs is pretty much hidden in the imaging. And that requires expert subspecialty interpretation to pull that out. We covered this last year in the Innovation Showcase. For the donor hospitals, 50% of them less than 3 donors a year, 85% of them less than 12 donors a year. So there's very little opportunity in that huge community reading group to have any kind of consistency. And that's the data that the transplant centers have been ingesting all these years. We estimate with 5,000 echoes, it's done in the donor hospital by 4,200 cardiologists, 3,600 biopsies done by 3,400 pathologists. So we used to think if we share the images with the transplant centers themselves, then it solves the problem. But with a 10-to-1 offer to acceptance, those 5,000 echoes and those 4,600 cardiologists, that becomes 50,000 reads if it's done by the transplant team. So that's 10 times the effort. But it gets worse because with continuous distribution, the number of transplant centers being notified, the transportation distance, and the expedited placement amount has gone up dramatically and will continue to do so. So if the transplant team doesn't trust the reports, in the past they would build in this huge variance. When we give them the images, they're trying to review it themselves, but it's a huge amount of workload and they can't even do it in the time frame needed. So how do we get to trusted data and reports? Well, how we do that is through a small group of subspecialties that have donor experience that provide consistent interpretations, and they provide transparency through these reports. This core reading group is very small, and so there's a much higher increase in the consistency. And because of that core reading group seeing so many interpretations, there's order of magnitude the number of interpretations that they read versus the donor hospital. But more importantly, what we're going to talk about for the rest of this discussion is about the reports and linking the images and the summaries of the interpretations to the specific reports. Okay, so here's a pathology sample of a kidney. This sample is quite large. It's a wedge biopsy. You can see all the glomeruli are tagged here. Normally, if a transplant center even got a digital image, it would be just the image, none of the annotations. You can see there's 126 glomeruli. These are all in green. The orange ones, those are sclerotic glomeruli, and this is really valuable to the transplant team. But what's even more valuable is this view, and in this view, all of the annotations are summarized, so you can see as you can very quickly scroll through. You can see the commonality. The ones that stand out, you can drill in, look at that, and you can see, okay, that's the edge of the biopsy itself. And very quickly, you can get a feeling that, yes, the number of glomeruli, you don't see any that are sclerotic and the ones that are actually called glomeruli. And then you can see the ones that are sclerotic, and then you can go directly there, look around that area, and get a determination just in a matter of seconds. And that gives you a sense of trust in the pathologist and for the rest of the interpretation. Okay, so here's an example of a report, an interactive report. You can see the image here. You can see the actual wordage here. But more importantly, you can drill into some of the specific details of that. This is a slight drill down, and you can see where they are, normal range. You can drill down into the EF, and then from the EF itself, you can see the different planes, and you can see the different images and which ones. These ones were not used for various reasons. These ones were used in the calculation. These are the ones that are flagged, and that's where the average comes from. So very quickly, you can drill down and see. The transplant surgeon can see where the information is coming from. If you want to look at the aortic valve and Pmax, it'll take you to the actual measurements, to the ones that were not used, and you can see various reasons that they're not used. But right away, there's the ability for the transplant surgeon to validate and to verify and get to trust. So hopefully those two examples have given you some insight so that you understand that when you have consistent, accurate reports done by experts, and those reports allow the transplant teams to drill down from the interpretation to the specific locations on the image, it allows them to quickly get to trust, and they get to a decline or an acceptance with confidence much sooner. Here are the modalities that we provide these types of services for. And if you want more information or you want to schedule a demo, please reach out to us at the information included here. Thank you so much for listening.